Okay, so my presentation today is going to discuss the findings of a study of Australian general practice nurses, knowledge, attitudes and practices regarding the influenza vaccination, and we conducted this in New South Wales. So why did we choose influenza? Well, it presents annually in epidemic proportions and can cause serious complications and even death at-risk groups. It's estimated to affect 5 to 15% of the world population annually, and these annual epidemics result in approximately 3 to 5 million cases of severe illness and 250,000 to 500,000 deaths worldwide. In Australia, major epidemics of influenza occur each year, and it's estimated that there are over 13,500 hospitalisations and 3,000 deaths per year in those aged 50 or over. It's likely that these numbers are underestimated, as influenza cases with less severe complications often go unreported or unrecognised, which you probably see that in practice all the time. At the very least, influenza outbreaks can cause hospitals and healthcare centres to become overwhelmed and can also result in high levels of absenteeism from work and school, resulting in significant productivity loss as well. In Australia, the cost of influenza-related GP visits is $10.3 million, and the total cost for influenza-related hospitalisations and GP consults is estimated $115 million per typical season. So that's a significant financial burden on the Australian healthcare system. Okay, so how do we prevent influenza? Everyone probably should know about all these already. We'll quickly go through them. So there's two ways of preventing the spread of influenza. First one is reducing contact with the virus by doing all those things over that side, covering the nose and mouth and hand hygiene, those kind of things. And then the second way to prevent it is to vaccinate to provide immunity. Generally, contact precautions are not sufficient in preventing influenza, as it can be transmitted up to 24 hours prior to the onset of symptoms. So people can be spreading it without even knowing that they have it. For this reason, the Department of Health recommends vaccination for any person greater than 6 months of age, and vaccination to be actively promoted in all adults aged over 65 years and people with an increased risk of complications. So vaccination is provided free to these at-risk groups by the Immunised Australia program by the Australian Government. Vaccination is also strongly recommended for people providing care to others, such as nurses and healthcare workers, and this prevents the spread and reduces the risk of exposure to at-risk groups. However, the vaccination for this group is not funded by the government at this stage. Despite the evidence supporting the influenza vaccination as an important public health strategy, vaccination rates remain suboptimal. And this highlights a need to explore the issues around vaccination, in particular the knowledge, attitudes and beliefs of those who are most frequently charged with vaccination, education or administration. So why did we choose general practice nurses? Much of the previous literature has only examined the knowledge, attitudes and practices about influenza vaccination within the context of the broader healthcare workforce, so including GPs, allied health, and just putting everyone together in one big group. And whilst its literature provides important information, it fails to adequately explore the specific issues related to nurses, particularly those working in primary care. Understanding the issues related to nurses is important given their unique role amongst health professionals as an educator, advisor and coach, as well as their high level of direct and ongoing contact with patients or consumers. Specifically, we chose general practice nurses for this study because the general practice is usually the first point of contact with the healthcare system in Australia, with over 85% of people visiting a general practice each year. The general practice is responsible for screening, prevention and chronic disease management, and is a place where consumers have prolonged engagement over time and so become familiar and comfortable with healthcare providers. So they develop quite a strong therapeutic relationship and trust with the healthcare providers. The number of nurses employed in Australian general practice has grown exponentially in the past decade, with now over 12,000 nurses employed in general practices across Australia. In the Australian healthcare system, general practices are one of the main administrators of vaccines. Many vaccinations are carried out by general practice nurses who are seen to be very valuable in improving influenza vaccination rates through making vaccination more accessible, often by introducing vaccination clinics and reducing the workload of GPs. In a study, one study, I found vaccinations were the single largest reason for consumer encounters with a general practice nurse. This study also found that the rate of vaccinations was actually higher than the rate of vaccination requests, which suggests that the nurse provided these vaccinations opportunistically when the consumer presented for some other reason. So this is clear evidence of the impact that general practice nurses can have on vaccination rates, and hence the reason for choosing this group for the study. So what did we want to find out from our study was that given that general practice nurses play a significant role in chronic disease management and preventative health, which includes administrating vaccines, the intent of the study was to understand their knowledge, attitudes and practices regarding the influenza vaccination, and they were the specific aims of our study. So how did we find out? So we utilised an online questionnaire to gather data about registered nurses working in general practices within the southern New South Wales, Illawarra, Shoalhaven and southwestern Sydney Medicare local areas. So I'll just point out now that this study was done last year when the Medicare locals still existed, and you all will know that that's since changed. These areas were selected for their proximity to the researcher, me, and the socio-economic diversity represented within the regions, and the study area comprised of a major city and inner regional and outer regional areas. It also had a population greater than 1.4 million people and provided significant diversity in socio-economic status, health and wellbeing and educational background. So our respondents were recruited via an invitational email sent out to the Medicare Locals mailing lists and also advertised within their regular electronic newsletters. The instrument that was used in the study was the King's College Nurses Influenza Vaccination questionnaire, which fitted really well to our study. We searched the literature and found this tool, and it was the best available to measure the concept that we were trying to find out. It comprised of items about nurses' knowledge of influenza and vaccination, their perception of risk of influenza, and items about the factors influencing their vaccination practices. So who responded? So I had 85 nurses respond to the survey. Most were female and were employed as either a registered nurse or a registered midwife, and the average age of respondents was 45.5 years. Almost half of the respondents had been working in general practice for less than 5 years, although respondents had been nursing for an average of 22.3 years. Most respondents worked part-time, and only 10 of them also worked outside of general practice. Few respondents held a master's degree, although 19 held a postgrad certificate or diploma. Half of the respondents were qualified nurse immunisers and had attended an influenza education or training session in the last 12 months. So what did we find out? We found that the knowledge level of respondents in this study was high, which was really good. We also found a significant difference in the knowledge between those who were vaccinated and those who were not vaccinated. There was less knowledge about the H1N1 influenza, and given the growing concern about the potential impact of pandemics relating to H1N1, this was of some concern. We also found that qualified nurse immunisers had a significantly higher knowledge score than those who did not have the qualification, which I guess we would hope that is obvious. Although there was no significant difference between risk perception and vaccination status or intention to vaccinate, there was a positive correlation between risk perception and level of knowledge. So that suggests that the more nurses knew about influenza, the more they saw the virus as a risk. Most of the respondents in this study agree that influenza can cause death, which shows that they recognise the seriousness of contracting the virus. However, most believe they did not get influenza easily, and that they were at low risk of contracting it. So they agreed that it was a risk to have it, but they weren't at risk of actually getting it. Okay, so literature frequently cites concern about side effects or no perceived need as the main reason for not getting vaccinated. This study supported this assertion, finding that after allergy and contraindications, concern about side effects and no perceived need were the highest ranking reasons for not having the influenza vaccination. The immunisation handbook lists anaphylaxis following any vaccine or component as the only absolute contraindication to the influenza vaccine. So it kind of illustrated that nurses might be overestimating the issue, and further education around the impact of allergies and contraindications in influenza vaccination is required. So compared to other studies, the vaccination rate amongst our group was high, at around nearly 80%. This may reflect the nature of the respondents being all general practice nurses, where influenza vaccination is more readily available than in other acute settings. Most respondents intended to receive the vaccination the following year and reported that they recommended influenza to consumers. Fewer respondents in this study reported being vaccination for the H1N1 virus than the seasonal influenza virus, and considering that the knowledge level regarding H1N1 in this study was low, it could be hypothesised that increasing the knowledge about H1N1 would increase the vaccination rates. We found that responders believe that they are in control of their own health and don't believe it's up to other healthcare providers or chance. They actually are, always in control of their own health and their own choices. Protection of self was the most frequently cited reason for vaccination uptake in both this study and others. And this suggested that the greatest motivation for vaccination is internal rather than external. So often it's thought that it's, a professional responsibility, but our study found that no, it was more protecting of self than actually seeing it as a professional responsibility to, protecting others. Respondents who had attended vaccination training or education in the last 12 months were more likely to have had the influenza vaccination, suggesting again that knowledge and awareness about influenza and the vaccine play a significant role in vaccination behaviours. And the fact that an increased knowledge about influenza and the associated vaccine may increase vaccination rates show that increasing the knowledge of nurses in regards to influenza and vaccination may be key in increasing both nurses' vaccination rates and enhancing the quality of the health advice that they provide to consumers, which you would hope would then affect their vaccination rates as well. So what do we need to do? Well, employers of general practice nurses should be informed about how actively promoting nurse education in their workplace will benefit both consumer safety and productivity. One of the most requested areas for further education by general practice nurses is vaccination training. Employers are encouraged to support practice nurses at their facility by allowing time to study and by providing financial assistance, as this is often a barrier for general practice nurses in meeting their education needs. Just under half of the respondents in this study were qualified nurse immunisers. Whilst the number of nurse immunisers working in general practice is unclear, can just stop there. Can hand up who is actually a qualified nurse immuniser, just out of interest? Okay, there's lots, that's good. Whilst the number of nurse immunisers working in general practice is unclear, not all general practice nurses have completed this training. And given that general practice nurses are responsible for both providing health education regarding vaccinations and their subsequent administration, it's imperative to ensure that administration of vaccines is being carried out to the safest and most competent level. Our national practice standards state that nurses must demonstrate the knowledge and skills to provide safe, effective and evidence-based nursing care, so that's what we all should be doing. And so to meet this requirement, we must be adequately trained and have the relevant experience to practice in a safe and evidence-based manner. For nurses to ensure that they are meeting their professional practice guidelines, future policy must include provision for acquiring the necessary skills to do so, thus making professional development a key priority. So the study highlighted that whilst there are similarities in findings from this study of general practice nurses compared to the studies of mixed cohorts with other health professionals, there was also some key areas of difference. Further large-scale research should explore the issues raised by this study, including education, risk perception and health locus of control, or who controls individuals' health. Undertaking this work with larger sample sizes and combining qualitative and quantitative data has the potential to provide deeper insights into the range of issues that impact upon influenza vaccination and general practice nurses. So we just kind of have scratched the surface, but there's definitely a lot more that can be learnt from going on from this study. Although the study provided data on the intention of general practice nurses to recommend vaccination to consumers, the actual advice nurses are giving to their consumers was not ascertained, and future research should look more closely at the role of nurses in consumer education and how the advice and information they are providing is impacting on the consumer behaviour. We've provided a better understanding of the knowledge, attitudes and practices of Australian GPNs in regards to influenza and influenza vaccination, and the findings are an important contribution towards guiding future efforts to both increase vaccination uptake amongst nurses and enhancing the support that they provide consumers regarding the influenza vaccination. And that's it. Thank you very much.
Do we have any questions?
Excellent work, Sarah.
Thank you.
And one of the interesting things which I think is so crucial for the future delivery of great quality care in primary health care is about the investment in education, training and support that you get as primary healthcare nurses. In your survey, now I might have just missed one of the bits, but did you actually ask the participating nurses about whether they drove the agenda for education or whether their practices paid them to go to education?
We covered, no, that was just really if they were nurse immunisers, if they'd had immunisation training in the last 12 months, but I don't think we covered any, if that was a barrier.
Yeah.
Yeah, if it was a barrier that their employers weren't paying for it or those kind of things, but that's...
That I think is a really critical part of future research.
Yeah,
as well.
We did find some data from other studies, I think mostly done by Liz, about training, nurse training and that kind of thing, and the barriers towards that. So basically this found that go and get educated, go and learn about immunisation, increase vaccination rates, increase the information you give to, better the information you give to the patients, hence increase their vaccination rates.
Have you published the findings of your study anywhere?
I've got 2 articles. One was the literature review and one was our results, and they are at the very, very, very final stages of editing to be published in the Journal of Clinical Nursing. Thank you, everyone.